This video will cover beta thalassemia, a quantitative defect in the production of beta globin chain, which can lead to red blood cell disease. Let's anchor ourselves to what's going on here. The boat with the Thailand flag represents beta thalassemia because beta sounds similar to boat, and Thailand sounds like thalassemia. The one cloud in the sky represents heaven because we tend to associate clouds with heaven, right? And the word heaven sounds like 11. So this represents chromosome 11, which is the chromosome in which the beta globin gene is located. Additionally, since there is only one cloud, it should remind us that there is only one beta globin gene per chromosome. The area that says no boats represents that inheritance of the beta 0 allele leads to complete absence of beta chain. The captain did not like that, and he's yelling nonsense while really shifting his attitude. This represents the fact that the most common mutations that lead to the beta 0 allele are nonsense and frame shift mutations. The area that says promoters only represents the beta plus allele. Since the captain can't go to the left, the only way he can go is where the sign is, and therefore he better feel positive, or you could say plus, about taking that path. This allele causes diminished production of beta chain, just like how even though he's not a promoter, he can probably get by just this time. The most common mutations that lead to this allele are either in the promoter sequence or in the 5' untranslated region. The 5' untranslated region is represented by that graffiti that someone did on the sign that's written 5', followed by some symbols or letters that we really can't translate, which represents, of course, the untranslated region. The TV was left on that channel that is very familiar. It reminds us of MCV, doesn't it? And the low volume represents low MCV in these patients. Now let's look at the candy. It will be a symbol for the Menser index, because Menser sounds like the name of that candy, doesn't it? And this index is simply the ratio of MCV to RBC, and it's used to differentiate thalassemia from iron deficiency. An index of less than 13 favors thalassemia, while an index of more than 15 favors iron deficiency. It looks like that package conveniently contains 13 candy pieces to remind us that this is referring to thalassemia. Lastly, there is a target sign. This one is simple, and it just represents target cells.